Ankylosing spondylitis, although it affects mostly the sacroiliac joints in the pelvis and the spine, it can affect some other body parts and systems because at the end of the day, it's still an inflammatory disease of the body. Fatigue is a very common symptom. Around like 65% of patients report it. The thought behind why that happens is really multifactorial. So one is the inflammation itself. So inflammation, of course, can cause your body to feel fatigued and tired. Pain itself has been shown to cause fatigue. So having the disease under control and having pain under control and being as functional as possible is going to help as well. Usually I start off with speaking to patients about their sleep hygiene, meaning how many hours of sleep they're getting a night. If they're not getting enough sleep, why that is. Is it, they're waking up in the middle of the night, they can't fall asleep? Then I get into more of the bread and butter of sleep hygiene, which has a lot to do with your sleep environment. So making sure you have a quiet, dark room that's cool enough in temperature. And then also talking to patients about what they're doing either in bed, whether they're watching TV or looking at their phone, which we know can affect the sleep quality. And then lastly, I talk to them a bit more about their diet, if they're having caffeine during the day, until how late, things like that, which can all affect your sleep. While there isn't that much and we need to do more research in how diet affects certain conditions, certainly in more inflammatory conditions, we know that more inflammatory diets with a lot of refined sugar and refined carbs can affect that. So I try to counsel patients on having as healthy of a diet as possible, meaning as many whole plant-based foods. Exercise is so important for any pain condition, but in ankylosing spondylitis, patients feel much more pain when they're inactive. It's called the gelling phenomenon, and they actually feel better when they're more active and move around their joints. So I frequently refer them to a physical therapist so they can start an exercise regimen that won't increase their pain. Ankylosing spondylitis can be a difficult disorder, and it really varies in spectrum, where some people are not affected as much as others. I would also say that it would be important that they're checked out for underlying conditions that we know increase fatigue, like anxiety and depression. Once all of those things are optimized, hopefully the patient would start to feel better and improvements in those different factors.